It's our pleasure to warm welcoming you, Dr. Nawal Al Mahyijari, to Royal Haya Hospital, Senior Consultant Psychiatrist, Clinical Hypnotherapist, Emotional Intelligence Trainer, Sultanate of Oman.
The pleasure is mine. I'm really enjoying my first visit to Kuwait and the first visit to Royal Hayat Hospital.
Thank you very much for sharing your expertise and delivering such a lovely presentation.
You are most welcome.
Dr. Nawal, at Royal Haya Hospital, the Women's Health Center under the leadership of Dr. Abu Bakr has been continuously developed and enhanced. And recently, a psychiatrist was appointed to support this vision. Given your experience in psycho-oncology and women's mental health and your role in founding psychiatric units in other hospitals, what would be your advice in these initial steps for establishing and developing psychiatric service as part of Women's Health Center?
First of all, I would really like to congratulate you for having psychiatrists in this hospital.
Thank you.
It's very important to have the psychological part. Beside the psychiatrists, it's very important also to have the next step of employing clinical psychologists. I would advise that beside establishing guidelines and protocols to practice psycho-oncology, the psychiatry team and the psychologist team should really implement educational like approach and materials, not just for patients and relatives, for the staff, for colleagues in different departments, because our staff and our colleagues usually they would help us collaborating with them. We need them to know what they're looking for, to understand the most common psychiatric disorders, how to look for them in order to facilitate referring these patients as soon as possible to provide the quality service for our patients.
Dr. Noel, given your commitment to women's mental health and the growing importance of mental well-being in oncology, what advice would you give to best support and integrate psychiatric care within oncology services?
The most important advice is to apply the holistic approach, the proper biopsychosocial interventions and approach in women's health and oncology services. Because to be honest with you, taking care of cancer patients and women is beyond just the hospital setting. It's beyond to the community after they finish the journey during the active illness. We need to take care of them after they go back home, to especially in cancer patients, because they go through multiple changes and they need to adapt to the new normal, I call it, new normal phase, which is beyond the hospital setting, especially in the survivorship. So keeping that in mind is very important in order to establish the proper biopsychosocial approach.
Okay. At the end, thank you very much again, Dr. Nawal, for your time, knowledge, and for engaging with us today. We hope to have the pleasure of welcoming you again very soon.
You are most welcome. The pleasure is mine again.